And then I think some people, out of curiosity or empathy or trying to understand what it is that a loved one is going through, could you kind of try to explain what feeling some of these different forms of dementia is like?
The good news is that the dementia experience of the person themselves is often better than for the people around them. And what I mean to say is that, I was with one of my patients on Monday in my clinic yesterday. And, the family is saying, like, he's happy as a clam. He doesn't remember that he has Alzheimer's. He doesn't actually think anything's wrong. He very happily works on the same puzzles and word games that he's done before. He may watch the same TV shows again and again, but he's happy as a clam. And, he'll tell the same story. And as long as nobody throws it in his face that he's told that story, 75 times, he enjoys telling it every single time, and he's just happy as a clam. Now, me, on the other hand, I'm happy that he can do the same activities. I'm a little tired of hearing the same story, again and again. But as far as he's concerned, it's totally fine. So, when people are at the stage, usually we're into the moderate stage of dementia or beyond. And again, the moderate stage is when they're having trouble with basic activities of daily living, like eating, dressing, feeding, things like that. At that time, people are generally fairly oblivious, and so from their perspective, it's probably okay. It in the earlier stages, in the mild cognitive impairment stage, in the mild dementia stage, it can be frightening. It can definitely be frightening. As you can imagine how you might feel if you realize that you are literally, losing your mind, losing your ability to remember things, to recall words, to recall, who everybody is and what's their relationship and how you know them. It can be a very scary thing. And how people react to that information, again, is a little different depending upon one's sort of personality and experiences. Some people, particularly older individuals, are can hopefully look back and say, I know I'm losing it now. I've had a good life. I understand. I'm not going to be 100% right now. I'm glad I took advantage of the time when I was 100%. And hopefully people can react like that. But some people are angry or frightened and things like that. And generally, if that happens, I like to use a very mild antidepressant and anti-anxiety medication, something like sertraline, whose brand name is Zoloft, or escitalopram, whose brand name is Lexapro. Both of those medications, which are in the Prozac family of medicines, just help to take the edge off a little bit so people aren't so distressed by their memory loss symptoms. And I would say I have roughly half of my patients on just a very mild antidepressant, anti-anxiety medication like that.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.